Hey guys, Coach Greg Jones. I'm going to be going over my Nutraceutical naturopathic supplements that I take in my regimen. I recommend to my athletes, recommend to my clients, recommend to my gym members, and the top ones that I recommend and take myself, and the reason why I take them. So first off is everybody, and I feel this is just mandatory, everybody should start with a fish oil. This is a Nordic Naturals product, Pro EPA Extra, so it has a high level of EPA and DHA to it. So if you do not eat a high amount of fatty fish like mackerel, tuna, salmon, if you don't have a lot of fish in your diet, you probably need some extra omega-3s in your diet. And this is the way to get it, so you do it twice a day with meals, and this is going to help cardiovascular function. It's going to help quell inflammation. And it's also going to raise HDL, which is a good kind of cardioprotective cholesterol that we have in our body. So that's number one. Number two is RN Cap, and this is by Thorne Research, and this is joint formula. So the joint formula has glucosamine, it has MSM, it's going to help your joint mobility. It's going to take about 6 weeks before you feel anything. It's not immediate. You're going to feel anything like sometimes like one of the next ones I'm going to show you is a B12 shot, and you're going to feel immediate energy from that. This is something you're not going to feel immediately, but it helps with a natural or a normal inflammation response to exercise, and that is because it has boswellia and curcumin in it, and that helps with those. So the glucosamine and the MSM are going to help with joint mobility. So this is number two, and anybody that is getting to be an older athlete, 30s, 40s, played competitive sports when you're young, you're probably going to have some kind of joint pain or mobility issues. These two are like number one and number two, what's going to help that. Number three is B12, and I get B12 from my naturopathic medical doctor, and this is for energy, it's for nerve conduction, it's for red blood cell production, but it really fights fatigue and helps your immune system. They found out, research has shown about 50% of the population has suboptimal levels of B vitamins, and being suboptimal in the Bs are not good at all. So you want this, and if you take vegans and vegetarians especially are going to be deficient in B12, and if you don't have a lot of meat in your diet. But one of the things that this specific form is going to be a little bit better for is B12 supplements. Oral B12 supplements are going to get broken down a lot in the GI tract, so this bypasses this by going right into the bloodstream from an intramuscular shot. So this would be number three. Number four is vitamin D3 and cholecalciferol, and this I also take intramuscularly, and I also get from my naturopath, and I'll provide that information in future videos, so you guys can, if you guys want to do that, or if you don't know about that, but everybody should have their vitamin D3 levels checked. If you are under 50 nanograms per milliliter, you're deficient, you're low. And it's going to compromise everything from bone health to immunity. You get deficient in this, you can get rickets. But a lot of people will get lethargic. It will help. A lot of people people that are celiac, or borderline celiac, or have Crohn's, usually are really deficient in vitamin D. Vitamin D is produced when your skin hits the sun, and so if you're in a place in the fall or the winter, doesn't get a lot of sun, your skin is not exposed to that, you're probably going to need to supplement. Again, this is the quickest way to bring up if you're deficient, and you should be in between 50 to 70. People with heart disease and cancer need levels of 70 to 100 nanograms per deciliter of vitamin D3. So the best way to do that is take it injectable once a week, and this 1 milliliter 1 ml of D3 has 50,000 units per milliliter. So some people take like hundreds of thousands, like clinical doses, like Mayo Clinic and stuff has done studies where they give people like 300,000 in a single dose, and then they compare that between taking oral like 3,000 for like 6 weeks every day. So you can get your levels up a lot quicker. Again, get it tested every 6 months. You should be getting your levels of 25 OHD3 is the test that you can get through your blood labs. So this would be number 4. Number 5 is another injectable that I take, naturopathic supplement. It's called glutathione. Glutathione is the master antioxidant and detoxifier, the main detoxifier of the body, and as far as the antioxidant goes. And this is going to help in recovery. It's going to help your immune system. It's obviously, like I said, it's a detoxifier, so it's going to help your blood detoxify. It's also going to help your skin. And what I found is it has taken my recovery back about 15 years prior in age. So I take one of these a day, and I recover a lot faster from workouts with this product. A lot of people don't know about it. Most naturopaths really just rant and rave about it. You can also do this IV in a push. And so a lot of doctors and naturopathic medical doctors that do IV therapy, Myers cocktails, you do a big bag of your whatever cocktail vitamins, and then you have to do the glutathione at the end and a push at the end, because vitamin C renders this useless, so you can't mix it in a big bag with everything else. It's got to be taken by itself, which is why I just do it by itself anyway. So you can do it IM or intravenously. And again, this is a product where when you take it orally, it's going to get completely broken down. Nothing's going to assimilate because it's going to be broken down in your GI tract. So it's the way you have to take this product. That's number 5. Number 6 is by Thorne, and it's called Betaine HCl and Pepsin. And this is good because it's going to help protein digestion and enzymatic activity. So it's going to provide your body more raw nutrient, or the enzymes, to help digest protein. And if you have a high protein diet, you're cutting down carbs, cutting down fat, and you're eating more frequent meals, like most people recommend with meal prepping, and coaches who have athletes eat more protein in their diet. And there's nothing wrong with more protein. Unless you have renal function, you're going to have any problem with your creatinine levels and any problem with your kidneys eating more protein, unless you have a pre-existing condition. If you have a pre-existing condition, then you need to talk to your doctor and get those checked. But you can have more protein in your diet. You can easily assimilate 40 to 50 grams. But what I found is when you take this, there's going to be no gastrointestinal problems ever eating a big meal or eating a meal higher in protein content. And it's because it provides the hydrochloric acid, the acid, to break down the protein. And it's going to be real beneficial. So people that have weak adrenals don't produce enough stomach acids typically, and then they have more GI issues. So if you want help with this, I would recommend this, number 6. Number 7 is Ashwagandha by Ayush Herbs, and this is cognitive and adrenal support. A lot of you maybe know, maybe don't know about ashwagandha. It is known as what is called an adaptogen. An adaptogen and an adaptogenic herb, what it does is it helps out the body's stress or stress levels. So, and that's what it means by an adaptogen. It adapts your body to stress. So lack of sleep, stress from work, too many stimulants, this is going to help with that. And it's also going to help with digestion. It's going to help with immunity. A lot of these things are all going to help with digestion, immunity, and recovery. And then some are specific. So if you have any questions, comment, ask me any questions you might have about any other vitamins or minerals. I'm going to do another completely different video and describe my bodybuilding supplements, my athletic supplements. But this is just like the basics. This is the basics, and I'm not even covering my multivitamin in here, and some other things that I take, and I'll cover all that when I cover my bodybuilding supplements or athletic supplements. This is just nutritional deficiencies and keep the body running optimally. A lot of things you should be getting tested for. You should be testing for B12. You should be testing for your D level, and you should be testing for B vitamins and your deficiency or your lack thereof of those three mainly. I'll go into magnesium, go into electrolytes, and go into some other ones, zinc, that helps in my next video. And thanks a lot for watching, and stay tuned for the next one. Thanks, guys.